You know me, Aaron, I might start dancing. Thank you. Thank you to Thornton and that panel. It was amazing. A terrific segue into our next segment. I'm Kathy Flieger, a member of the SCbio Board of Directors. And for over 20 years, I've been doing projects with healthcare providers and with industry. I've done projects on ER workflow, on quality core measures. With industry, I've worked on strategy formation, technology evaluation, and product development, always separate projects. And in doing that, you can see where there's so much more to gain when these two parties work together. That's why I'm so excited about the partnership between MUSC and Siemens Healthineers. Let's take a look at a video as our panel members come to the stage.
There are a lot of challenges that we have to face in healthcare today. And I think that the honest truth is that any one entity, any one enterprise has certain strengths, certain capabilities, but the problems are bigger than one individual, one group of people. It requires partnership to be able to successfully move into the future.
It's the dawn of a new era. Technology and innovation are reshaping many aspects of our lives, and in some cases, enabling life itself, often in ways never dreamed possible.
Innovation is how we change the future for our patients.
The pace of this innovation is breathtaking, fueled by bold visions, unrelenting effort, immeasurable compassion. It's made possible by deeper, more strategic partnerships between the architects of these evolving pathways of care. The future of healthcare lies in the shared commitment of many, working as one, all for the benefit of patients and their families. For the residents of South Carolina, that future is now. The Medical University of South Carolina and Siemens Healthineers are embarking on a first-of-its-kind journey to transform care delivery. In a revolutionary new strategic partnership, these two industry leaders are combining their collective resources and expertise to develop innovations that will evolve clinical care pathways, improve patient experiences, and drive performance excellence. Our mission is to transform value-based care in the state of South Carolina while creating a blueprint for the world to follow.
I would say that our partnership with Siemens is actually globally unique.
There is a fascinating dialogue necessary between experts in medicine and experts in technology. And only when two partners team up, true innovation happens.
Together, we are ushering in a new era. Together, we are changing what's possible in healthcare.
Together, we're going to be able to do something that's far greater than what we could do individually.
Wow. Thank you. Thank both of you for being here. I know these guys don't need an introduction, but I would like to welcome Dr. DCole, President of Medical University of South Carolina, and DPacitti, the CEO of North America for Siemens Healthineers. Welcome. Thanks both of you for being here, and as we get started, since it's the end of the day, I've told you why this partnership is so important to me. I want to help you understand why it's important for you. So how many people in the room know someone who's had a stroke? Raise your hand. Okay, keep your hands up. And how many people have had someone in their family who have had imaging done? Ultrasound, MRI, any sort of imaging? Raise your hand. Okay, so for everybody whose hand is up, this partnership is going to help you. You both have very impressive titles. President, CEO, but I think the bigger, better title is visionaries. Can you tell me a little bit about what your vision is for this partnership?
You heard in the prior session about all the challenges in healthcare, and Thornton talked about how healthcare is not broken, but I would say that at least under the topic of healthcare delivery, it is fractured. I'm speaking as somebody who's been in healthcare for 30 years. It's fractured. Most patients end up with a yeah, but experience. Yeah, I like my physician, but it took forever to wait in the ED, or they messed up this, or they couldn't do that. We have to provide better value care with our patients in the epicenter. We have to put our patients in the middle of what we do and build systems around it in simplest terms. One of the things that we realized at MUSC, we are the academic health center for the state of South Carolina. We provide the quaternary and tertiary care, the specialty complex care, and also we educate the future for healthcare in South Carolina, in some places, the United States of America. That responsibility means that we understand that we're limited in our resources and we have a bigger problem to face that requires partnerships. We're looking for partners that have synergies that allow us to transform the delivery of healthcare in simplest terms. And our hope is that it's not about MUSC and not merely about Siemens, but actually defining new care pathways, defining better ways to provide value care that then can be duplicated and transformed elsewhere. So to me, that's the excitement about this, the opportunity to transform how we deliver healthcare in a very fundamental partnership that allows us to use each other's strengths.
Yeah, I would say, I would echo everything you just said. I also would say that, as you heard again from the previous group, there are challenges, and as a medical company and an innovative company, we often have been focused in the past about creating a new product and selling a new box of some sort, but with the complexities around the globe, I might add, not just in the US, of delivering healthcare, we know that it's important that we provide solutions, and we really want to transform healthcare delivery. And I think as we got to know the folks better at MUSC, we saw a great opportunity from a partnership standpoint to really look at key subject areas that needed, I would say, improvements in some way, shape, or form, also lowering costs. That would be a great partnership.
Thank you. And Siemens is a global company, and you could pick anybody to work with. You've talked a little bit about why you picked MUSC. Why was that connection so special?
Yeah, I think that, from our perspective, MUSC's focus on innovation was really important to us, willing to try things differently. Not everybody has that same type of feeling. Great expertise from a clinical standpoint. You heard our CEO, my boss, Dr. Muntag, talk about we're not the clinical care experts, the healthcare providers are. And so that was a really important part for us. And then obviously we already know that MUSC is strong in research. That's another component to it. And then we often forget there's another really important part of this, which is education. And we want to make sure we're focused on education with MUSC, for not only patients, but for other providers, clinicians around the globe.
And likewise, MUSC has a lot of companies that you work with. Why was it special that you work with Siemens?
I think it's important that we are purposeful about our partnerships, that we have strategic partnerships that have a synergy and impact. I think I would echo everything that Dave just said, and I would also add that in any relationship, at some point, it fits. You have a similar culture, you have a similar value system, a similar purpose. And so we found early on in our sort of discussions, building on a base of decades of research and relationship at a more sort of basic level, that there was a strong potential here to develop a relationship that could have an impact. So we found that there is, in simplest terms, a common road that we found important that we were willing to walk down together.
And in terms of this partnership, tell me about exclusivity. Is this an exclusive partnership, or you're still going to be working with other industries and for you other healthcare systems?
I think definitely this, and we'll talk more about it, it's a first of its kind, but I think the expectation is we'll both take elements of it and work with others, and we want to do that. I think both partners want to do that, and I think it will only help both of us expand and grow.
And in terms of how this partnership is going to play out, how long do you envision it lasting?
At the moment, we have a 10-year overarching agreement, and there's many moving parts underneath that. I think, again, the basis of that is that we need to have a longitudinal viewpoint about how we're going to do things differently.
Thank you. There are a lot of partnerships. We hear a lot about partnerships. We've been talking today a lot about collaboration. How is this deal kind of one of a kind and revolutionary?
From our perspective, we really haven't. We've done a lot of research around the globe with institutions. A lot of it's been technical research, which has been great and definitely groundbreaking in many areas. But this is really the first time that we've embarked on a journey to transform health care delivery in certain clinical areas, and then we'll continue to identify new areas as well. But for us, this is game-changing for us because we needed a partner like MUSC to be able to do something like this. And again, it takes two to tango, so to speak, and Dr. Cole and the team were also highly interested in that as well.
So it was a good match.
Yeah.
In terms of the foundation for this partnership, how have you guys worked together in the past, and will that continue?
Yes. We have a longitudinal relationship in terms of research. We have actually world-class MRI radiologists, and the reason they're world-class is because of the research partnership with Siemens over the last 20 years that have actually developed the best technologies with Siemens as a result of that partnership. So that was a basis for how we started a further conversation. Of course, there's a transactional portion of things. SCbio Towers, for those of you who are familiar with MUSC, that entire facility is filled with Siemens technology, right? So they have best in class in many, many dimensions in terms of best technology. So those are the first reasons why we started to talk a little bit further. But I think it's important to understand that MUSC is in the middle of a transformation. You heard earlier about the fact that there's all these different moving parts in healthcare. We can't control everything that happens in Washington, D.C. on a daily basis. I told somebody a couple days ago, I'm looking for that predict a tweet app. You know, we could know what that looks like. But by the way, the conversation in D.C. is about healthcare access, or lack thereof. And there's a parallel that has to happen, which is, personally, my belief, if we don't transform the ineffective, wasteful, fractured healthcare that we deliver, we're going to break the bank if we provide healthcare access for everybody. Just for the record, I am strongly for healthcare access, but we can't work in isolation. That means that we are responsible for transforming how we deliver healthcare, and that we actually deliver health, and to emphasize health care, not illness-focused care. That requires a stronger breadth and depth and capability through partnerships to look at the entire spectrum of what we do. And also, we have to be able to do so with higher, everybody says value of care. What does that mean? Highest quality, lowest cost. Highest quality, lowest cost with best care possible. So those are alignments with Siemens. Siemens is actually starting to talk, and certainly Dave will, I'm sure, follow up on this. I was so excited when I found out that they are actually focused on helping in partnership provide the best value care for providers. Wow, there's an alignment. It's not about selling MRIs or CT scans per se. It's actually about taking a broader view to change what's important for those that we care for, our patients.
Thank you. That's very visionary, and that's what I think is so special about this partnership, is that you are both so closely aligned. What are some of the initial projects that we could see coming out of this partnership?
So we've identified a couple up front. One is related to stroke care. The primary focus here is looking at the pathway of a stroke patient from door to intervention or needle time. We think there's an opportunity, obviously, with the clinical experts from MUSC to improve the pathway of that patient. Ultimately, as Dr. Cole said, delivering the care more effectively at a lower cost and reducing unnecessary variation. And I think we can do that with some of our expertise as an imaging company, and I think obviously with the expertise from MUSC from a clinical perspective. The second one is probably a little bit more futuristic. We're the leader in artificial intelligence. In fact, we have the second most patents only to Google in that area, and it's been fascinating. We have an innovation center in Princeton, and one of the things we've developed is the ability to do a digital twin. You know, we can do a digital twin of you. We can do a digital twin of someone's heart, and the digital twin allows you to attempt to try procedures, look at potential outcomes with someone's heart or another part of their body. But we also can do a digital twin of an infrastructure. And as you know, this beautiful children's hospitals being built at MUSC, the Sean Jenkins Children's Hospital. And we see a big opportunity there to use our artificial intelligence technology and machine learning and creating a digital twin of the institution. And what we're looking at now there, as it's being built, is looking at the pathway of patients, actually looking at the overall patient experience. You can actually simulate all this. You can look at 1,000 different variations of people, how they enter the hospital, how they leave the hospital, where they're going to sit, where the procedures are going to happen, and it can simulate all this and give you outcomes. So, I mean, this is groundbreaking area that we're in as an institution, and I think really exciting for us to partner with MUSC in these two areas.
If I might just add to that on the stroke piece, and let me back up a moment. In my view, my father-in-law was a fighter pilot in the Air Force. He flew jets. And I always tell people, if you think about it, he actually didn't fly jets. He had computer-assisted piloting. And if you consider what happened in that space, it's unbelievable. If you look at the Air Force and what our fighter pilots do. We are on the front end of computer-assisted medicine. And that is a huge opportunity. Artificial intelligence, predictive analytics, the ability to do things better and more on the front end to provide and prevent problems is groundbreaking. So if you look at what Siemens brings to the table from our perspective, you talk about stroke care, typically what's the terminology is door-to-needle time. When somebody gets in your front door, they have a stroke, how long does it take to get to where they actually get treatment for their stroke? Door-to-needle time nationally is about 90 minutes. That means you have to come into the emergency room, somebody has to come see you, they have to figure out what's going on. And by the way, what happens now, you go to an imaging suite and you get a scan that says, oh, you've got a clot. And you get off that table and you go to another place, the OR suite or the interventional suite, and then you treat. That's 90 minutes. You know, we actually, with all humility, MUSC is nation leading in terms of stroke care, in terms of time, process, and outcome. Our goal in partnership, 25 minutes. We want to cut from 90 to 25 minutes. Think of the implications of that. The stroke that didn't happen goes everywhere. The families that are not torn apart by somebody dying or being disabled the rest of their life, the jobs that are not lost because of their disability, the rehab that's required, so forth and so forth and so forth. How does that happen? Artificial intelligence, predictive analytics, and by the way, another strength of Siemens, integrated platforms which are emerging. So by the way, in the future, I would envision we have a better ability to get patients to us, to get them the decision making, and to get them into one imaging place, not two, one. Just cut 25 minutes off just by the technology. Those are the sort of things that are going to be game-shifting paradigms. And we don't want to own that. We want to share it. We want to define the best practice nationally, internationally, and share it over and over and over. That's what's revolutionary about this partnership.
Thank you. That's amazing. I'm so excited about it. What else in terms of stroke, other than stroke and digital twin, could you envision?
I could go on forever, so forgive me. We're about to open a brand new, the Sean Jenkins Children's Women's Hospital this month, next year. It will be transformational. One of the reasons why it's going to be transformational is we have a wired hospital that has an opportunity to be, for lack of a better term, a smart hospital. That partnership with Siemens allows us to build in processes that can actually start to predict and get patients in the right place at the right time over and over. It sounds simple, but I would tell you that in general, what happens in a hospital is isolated, siloed, organized chaos. It is. So the opportunity to start looking at, in another strength of Siemens, the greater portion of Siemens is in terms of manufacturing and process. When they talk about digital twins, they're talking in manufacturing and starting to focus it on healthcare and healthcare delivery. We have a first in practice opportunity to get that focused into the children's hospital. So we can develop a children's hospital that is world-class and really unparalleled in terms of the effectiveness of what happens, getting the right care to the patients, the best value care, the least repetitiveness, and things that, again, I started out by saying everybody has a yeah, but experience. So you're not waiting to get discharged for 5 hours because the team couldn't figure out when to come around on you. That you're not stuck waiting for that procedure in the hospital for that day because the logistics are such that you can't get the MRI scans that you need before we can get to the next decision. That your elective surgery is not actually canceled, that you had on schedule for 3 months, true stories all the time, you've experienced them, because we didn't have OR time. There's a huge opportunity to develop and leverage the technology to provide better, more effective care. We have to embrace it. We cannot face the future and ignore the tools we have. I tell our medical students on a continual basis, because they wonder about the future of healthcare, you know, I tell them 3 things. I say, when I wake up at 3 in the morning worrying about that, first question, Do we need healthcare providers in the future? Absolutely. Second question, do we have more tools now at our fingertips than in the history of man to transform how we deliver healthcare? Absolutely. Congratulations. Congratulations. You live in a wonderful time. And this partnership is going to make that a reality in many, many ways.
Makes you wish sometimes probably you could ratchet back and get to have your clinical experience in that environment. Now you get to really affect it for generations of others.
Sure, it might have less gray hair at this point in time, if that were the case.
So it sounds very ambitious. It also sounds challenging. And you talked a little bit about sort of organized chaos. I imagine it's not going to be easy. What are your success measures?
Well, first, we've established oversight groups. We know that we just talked about this actually today, the importance of having a lot of discipline in managing these projects and having all the right experts in the room at the right time. So there'll be a set of oversight groups that look at each project and make sure we're staying on time and delivering the goals that we've set. We are establishing very specific measurements that we need to deliver, things around unnecessary variation and reducing that, reducing waste. In the end, we talk about transforming healthcare, but it's really about improving outcomes, right? And obviously, MUSC is incredibly focused on that, and we want to be a part of the equation helping improve outcomes.
In terms of challenges that you foresee, I know you guys have been meeting all day today, working together. What are some of the things that you see as hurdles that you're going to have to overcome?
There's too long a list to outline to answer fully. I would say a couple comments. One is that we both agreed early on that if our partnership was effective and doing the right thing, we're going to make each other uncomfortable. We're going to. And that's a good thing. So in the middle of that, I think another huge challenge is we're talking about, I keep using the word transform and change. It is hard to change human beings and our behaviors that we're taught and have been embedded in who we are. It is hard, I'll emphasize that. So when we talk about doing things differently, everybody's all for change until, well, but not in my backyard. Don't make me do something different. It's as long as it's okay across the street. We're talking about a change that's fundamental, that is going to be a lot of hard work. But I continue to tell my team and the people that are at our institution, our greatest risk is to do nothing. We have to change how we do things. And I feel it so strongly. I will say this till the day I die. The patients are our purpose. Innovation is how we change the future. We have to change what we do.
Well, on that note, I will turn to the floor for questions. Does anybody have any questions for these two gentlemen? Sam. Absolutely.
There we go. Took three of us. First off, I'm both encouraged, fascinated, and excited by the partnership. I was, in my humble role, coming down to Charleston for the mysterious announcement that day, and maybe had some inklings. This is exactly where we want to go, and I think these kind of creative partnerships. So President Cole, thank you for, making this a reality in South Carolina, and Mr. DPacitti, thank you for your faith in the talent that's here in this state and what have you. This is a little bit of an offbeat question, but since people didn't jump too quickly, I know Siemens Healthineers has gone through an IPO recently, is a huge, huge company on its own, tens of thousands of employees, multi-billion dollars, but part of the overarching Siemens brand and company that also has pretty dynamic relationships with our other two major research universities in the state, Clemson and the University of South Carolina. I know you can only focus on so many things at one time, that's for sure, and this will take a lot of focus. As we're talking about collaboration, though, and alignment and synchronicity and leveraging things, do you see an opportunity? I don't know if that was a coincidence that Siemens has gotten this involved in South Carolina, I'm grateful for it. Is there an opportunity to figure out how to leverage that somehow?
Good question. I think some of our presence has to do with how well one of the football teams has been doing, by the way. But on a serious note, I think, one, there is an opportunity to leverage, and to your point, we have different parts of Siemens working with other institutions. We actually all talk, and obviously this, and also other industries have invested tremendously in this state. Obviously, it's a great place to invest. The innovation, across the state is inspiring to see, and I think also the willingness to try new things. It's not just here, but other parts of the state as well. So I think there'll be continuing opportunities to develop and leverage in many different areas. We even talked about there's huge opportunities on workforce development and on our side, and maybe even on the hospital side, so that we can see expanding in many different areas.
Thank you all for the discussion. I heard earlier some comments about telemedicine, and even a few weeks ago heard somewhat counterintuitively that telemedicine actually, even though it's away, you're getting the medical treatment in your home, so you're more comfortable, you don't have to wait in line, has so many advantages that I never really thought of that are kind of counter to showing up and seeing a doctor live. Can you all comment on how the partnership might enhance telemedicine and seeing that improve?
So telemedicine is another topic which I can go on far too long. I'll just make the statement, it will transform the delivery of health care, especially in underserved areas. And we're in the middle of that as we speak. Telestroke has made, in the state of South Carolina, the fact is that you're not further than 45 minutes away from best standard of care, because the 24/7 stroke teams, which are available across the state, can go into any ED to help the doctor make the right decision at the right point in time. So if you look at that dynamic space, another dimension is point of care technology, which will enable equal or better care at home or locally than traveling 3 hours to either Greenville or Charleston or Columbia or something like that. I think the technologies that are evolving in Siemens and the paradigms of how we take care of patients will probably interface very dynamically into that space. Technical ability to have better point of care capability, better decision making in terms of, does somebody really need to be here and what care does that be? Better provide what's the best care locally. One of our running purposes at MUSC, we don't need every patient at MUSC. What we need to do is partner, and with our partners provide best care that's possible locally. And sometimes patients need the complexity of care at MUSC. We have to have the integration to make that happen. So best care locally is something we truly believe in. Telehealth is a tool for that.
Yeah, I think with some of the technologies we have in artificial intelligence, the ability to look at images remotely is a big possibility. I think that having wireless point-of-care devices like an ultrasound device you can hold in your hand and do a quick scan and send it back to clinicians. And as Dr. Cole mentioned, we also have the ability to do quick blood analysis with a handheld technology and a card about this big to get basic blood work that can be done right there with the patient at home or nearby in a clinic. These are all things we're working on. We want to continue to develop them with MUSC, and I think there's endless possibilities in this area.
Any other questions? Somebody on this side?
So it sounds like, so this partnership between Siemens and MUSC, though, it can obviously provide a lot of growth opportunity for the both of you. Just from the South Carolina perspective, does MUSC plan to pursue other partnerships?
So the short answer is absolutely, yes. I think that there's many, many domains. It's not about the number of partnerships, it's about having partnerships that we believe that with that partner, we can together make a difference. And I think I would expect Siemens would say to have the same paradigm. So absolutely, yes.
I would just add that even within this partnership, we see the opportunity to bring in other partners of ours on the device side. There's a lot. We work across and have strategic alliances with companies in cardiology and oncology and orthopedics, and we see an opportunity to bring in those strategic alliance partners in expanding what we're doing right here at MUSC, even with those partners as well.
other questions?
So,
I think, I just wanted to say that the technology that Siemens has is absolutely amazing. And I know that MUSC welcomes sort of engaging with the community. And so if you are in the room and you want to, do a visit to MUSC, I think Caroline and her group would be happy for you to come in and take a look at it. I know they had an opportunity for you to tour as a part of the conference at the beginning. But if you're curious about what's going on, I invite you to get involved, engage with MUSC and Siemens, and take a look. It's very exciting. I want to thank Dr. Cole and David DPacitti, and I say that we all appreciate you taking on this challenge. It takes a little bit of bravery to do it because it is quite a challenge, but I am confident that you are up to the task. Thank you so much.
Thank you.